let's talk about the health service. So today you're announcing you want everybody over 70 or with a serious health condition to have the right to have their own GP, a named GP, to use the jargon. With respect, I've heard politicians make that promise on a lot of occasions. How would you do it with no extra money? And is it really feasible in the NHS in 2024?
Well, it's really important that people do have a named doctor, particularly if they're over 70 or have got a lifelong condition. All the evidence shows it improves their health outcomes. It actually saves the NHS money because people don't go into hospital so often. So it's a really sensible policy. You're right, others have promised it before, Jeremy Hunt did, but I'm afraid what they implemented was a sort of tick box exercise. It's not been implemented. So many people complain they don't see the same GP. And so the way to deliver it is to have many more GPs. What we have been saying in the Liberal Democrats for some time now, and we've worked with health experts on this, we need 8,000 more GPs. You can't deliver that overnight. We reckon it would take at least 4 years. It would cost an extra £1 billion every year for those 4 years.
And where would that money come from?
Well, we've said that the tax cuts that the Conservatives have given to the big banks since 2015, they should be reversed. That's worth £4 billion a year, so not just pays for this part of our policy to get more GPs, so you can get a named GP, but for many other parts of our health and care policy.
And GPs working now, though, who already exist and are in practice, rejected the government's new contract for them, saying it didn't provide enough new funding. If you want to get more GPs in future, would you, as Liberal Democrats, say that GPs right now should get more cash?
Well, yes. I mean, what's happening, the settlement for GPs this year is, I think it's less than 2%. And that means when I go around in the local elections talking to people campaigning, meeting GPs, they say that they may have to lay off members of staff because the amount of money that the government are putting forward is way too little. That means this situation, which is dire at the moment, is going to get worse under the Conservatives. So that's why Liberal Democrats in the local election campaign have put the health service and care right at the front, along with what we've been saying on sewage and crime.